Health and Human Services Committee to order, and I'm going to turn it over to my vice chair, Representative Jaspers, because
Madam Chairman, do we need to say a little prayer for you?
probably, but it's okay.
I'll hold your hand for a minute,
No,
and I'll be
don't
thinking about you.
touch my hand. Now you're going to wash your hand.
Oh, well.
Yeah.
I'm a country boy. It'll be all right.
Oh, country boy.
Love to aggravate. But, committee, you've been given a substitute. Look on your desk. They handed it out just a few moments ago. Oh, I need to turn it. Are we on? Okay. And LC 336101S. We look forward to hearing Madam Chairman present her bill. And Madam Chairman, we'll turn it over. Do you want to do it here or down there?
Huh? You want me to just sit at the table?
Okay.
And if it's all right, Mr. Chairman, I'll ask Joe Donnelly, who is president of the Physical Therapy Association and a professor of physical therapy at Mercer, to join me at this table.
Okay, absolutely, Madam Chair.
Of getting the play.
Just don't touch your hand.
Okay, thank you, Mr. Is it on? Yeah, it's on. So can you hear me? Okay, thank you, Mr. Chairman and members of the committee. I bring to you the substitute to House Bill 505. It's been about 20 years since there's been a modernization of the Physical Therapist Practice Act. And so basically why this one is rather lengthy is a lot of it is to modernize that Practice Act. Just like a few years ago we modernized the Medical Practice Act. The difference in this one would be that we now have an area for physical therapies to have patients self-referrals for a very delineated time period. That would be for no more than 8 visits in a 21-day period of time. If at any time during that period the patient shows any signs of getting worse, there is to be an immediate referral to a physician, and there are penalties and all not delineated in the bill, but for there to be action taken by the Board of Physical Therapy if a physical therapy does not do this. The people that will be able to do this is not just every physical therapist. If they have a doctorate and 2 years of clinical experience, they will be able to have self-referrals. If they have, I'm going to have trouble remembering. If they do not have a doctorate, it's 5 years of clinical practice. And did I miss one? That's the DPT and then one where they have the master's training. So it's not just your average physical therapist that is right straight out of school. It defines the term physical therapy. I know that there were some questions from the chiropractors about physiotherapy, and that has been removed from the bill. And this is a carefully crafted agreement between the physical therapist and the orthopedist. And with that very disjointed, because I feel so bad, explanation of the bill, I will be glad to answer questions, or I will have Joe answer the questions for you.
Madam Chairman, I just have one. You just said that physiotherapist had been taken out.
Yes.
It's on line 28. Physiotherapy. Okay.
That was the word that the chiropractic association questioned. I'm sorry.
Okay, thank you. I just wanted to make sure I was clear.
No.
Anybody else on the committee have a question for Madam Chair? Representative Kidd.
A couple of them. You say physiotherapist has been taken out?
Yes. Physiotherapy.
Who can use the word physiotherapist?
Okay, Joe, go ahead.
My name is Joe Donnelly. I'm a physical therapist, president of the Physical Therapy Association of Georgia, and a clinical associate professor at Mercer University. The discussion with our chiropractic colleagues was that physiotherapy can be considered in generic terms. There are things that they do in practice that encompass that provision of physiotherapy, but however, a physiotherapist and a physical therapist are thought worldwide to be the same. And so we compromised with them and removed the physiotherapy from the language so we would not have any friction. Is that?
Okay.
If I may,
Excuse me,
and I'm just now reading, hadn't read all the substitutes yet, but a couple other questions. Who can perform physical therapy functions, or what you might, can anybody other than a licensed physical therapist perform any of the functions that a physical therapist is licensed to do?
A physical therapist or a physical therapist assistant under the supervision of a physical therapist can provide those services. A physical therapy aide cannot. They can provide routine designated tasks, but they cannot provide any components of the physical therapy care.
All right. Can a medical doctor in his office, or in their office, excuse me, because there are a bunch of female medical doctors now, I apologize. Can a medical doctor in their office, directly or under their direct supervision, perform any of the duties and functions that a licensed physical therapist can do?
My first guess would be no, that it clearly states that physical therapy has to be provided by a physical therapist or a physical therapist assistant under the direction of a physical therapist.
Thank you.
And federal statutes, Medicare, CMS would make that same
one or two other questions. In the old act, it said a physical therapist had to use the initials PT. You struck that in this act, and it doesn't say in this act what a physical therapist has to wear on the name tag, that bill that we passed last week.
Correct. So in consistency with the Medical Association of Georgia's identification bill, we became consistent with that and were supportive of the identification of physical therapists in practice wearing that identification that they are a physical therapist.
So what will the name tag say?
Physical therapist.
All right. It doesn't say.
Abbreviation.
Not the abbreviation.
Does that say that in here?
No, but that would be a rule by the board, crafting rules about the language as we move along if it should pass.
One last question, and I'll be quiet until I read the rest of it, if I may. Can a medical doctor supervise or have a physical therapist assistant in their office? Physical therapist might have gone to lunch somewhere. Can a medical doctor supervise a physical therapist assistant?
Representative, I don't think that you would ever have that scenario. Have you had a medical doctor question you about the ability to oversee a physical therapist?
Well, he said a little earlier a medical doctor couldn't do some of the things that a physical therapist could do.
Okay.
So the answer to the question would be no. Only a physical therapist can supervise a physical therapist
Thank
assistant.
you.
Representative Broderick.
Thank you, Mr. Chairman. Got a question here, and I want to make sure I'm understanding this right. In lines 216, if this went, if the bill passed and the physical therapist is somewhat operating as an independent practitioner, they would not be able to order, test, x-rays or other body fluid testing, diagnosing a disease or practice medicine that would not be allowed. And two, as an independent practitioner, I know they do have provider status now. As an independent practitioner, as a provider status, they would be able to be provider status under Medicare, Medicaid, and commercial insurance.
Okay. Well, first let me answer the first one. No, they will not be able to order
Testing.
testing of radiology
I
or
think
any
that's
other kind of
precluded in here.
testing that's listed in the back. And in fact, when they have this self-referral by patients, they are to give the patient at the first meeting a statement stating that they are not working under a medical diagnosis or radiological reports. In other words,
And then along that same question with this, certainly part of the profession is assessment of the patient. And under this, would you construe assessment as diagnosis?
go ahead.
The consensus from our negotiations with the Georgia Orthopedic Society and initially with the Medical Association of Georgia was we came to the term physical therapy diagnosis. Physical therapists make unique diagnosis based on assessment of movement, of the movement system.
Okay, thank you very much.
Thank you. Representative Sharper.
Everything's okay. I was looking at the line 28 thing about physiotherapy and physical therapy, so that's
Thank you,
clarified.
sir. Representative Petrie.
Yes, sir. I just wanted to emphasize, wanted to make sure I've got the nomenclature right here. So we changed, we took physiotherapy out, and that appeases the chiropractors. Is that correct? Or to some extent, but isn't...
I mean, that's the suggestion they made, and that we did do what they asked on that.
But
And
really...
that's the only suggestion.
That was their only concern. But are chiropractors really authorized to provide physiotherapy?
There is a national certification, I believe, that the Chiropractic Association offers that provides some physiotherapeutics, which is, again, in that generic term of physiotherapy, which would be electrical stimulation, ultrasound, those types of things that traverse the scope of practice of between a chiropractor and a PT. So that's why we said we're good with that. That was a reasonable concession to make.
All right, thank you.
Representative, one time when we changed something, we apparently gave the acupuncturists, or at least they thought they had the exclusive right to do dry needling. And we had to come back and correct that because physical therapists do dry needling. And so there is this, in the area of treating patients, some areas that do cross over a bit. And apparently this is the one like that.
Thank you, Madam Chairman. Mr. Donnelly. If you want to hang there, we've got just one person who has signed up to speak, Ryan LaRosa from MAG. If there's someone else that, excuse me, Ryan, there's people wiggling around. If you want to sign up, we'll push this up here and you can. Thank you, Ryan.
Thank you, Mr. Chairman, members of the committee. My name is Ryan LaRosa. I'm with the Medical Association of Georgia, and I wanted to let you know our organization is neutral on this bill. I take any questions.
Committee have any questions for Mr. LaRosa? Madam Chairman.
Mr. Chairman, can I reiterate again to the committee that this is a very carefully worked out compromise between the orthopedists and the Orthopedic Society and the physiotherapists, which are the two groups most involved in this bill.
Thank you. Thank you, Ryan. Appreciate you being here. We'll wait just a second. Yeah. Yes, sir, Representative Kidd.
The chair lady's good friends with Blue Cross Blue Shield and so forth.
You're here now.
Probably
You're trying to get her
nobody,
blood pressure up, I believe, aren't you?
probably any group that I support that Blue Cross Blue Shield has a chance not to pay, they probably won't pay them, Representative. And I'm being funny in case there's a Blue Cross Blue Shield representative here.
I think they were scared to come to this meeting or any other meeting in the future here. But would this bill allow physical therapists? Well, right now under the law, if a practitioner refers someone to a physical therapist, then the physical therapist has the right to direct bill third party for the treatments and evaluation stuff that they do. Under this bill, they would be able to direct bill third party for patients that came in to see them without any supervision or direction or prescription from an additional practitioner.
Representative, that's true. They would be able to, but it is strictly up to the carrier whether they want to pay them or not. Currently, some carriers and some plans do pay them already when they've had a thing that they've been able to do on an evaluation. And in some states, they do pay on self-referrals, but it'll be strictly, there's no mandate. It's strictly up to the carrier.
Thank you.
Thank you. So next up to speak is Karen Matrick. Is that right? Did I say that right?
That's close.
If you would, over to the air, just tell us your name, how to say it right, please, and who you're with.
Yes, sir. I'm Karen Mathiak, and I'm chairman of the Board of Examiners for the state of Georgia. And Representative Cooper, thank you so much, and ladies and gentlemen, for letting us speak here today. We did have some concerns, and the one thing that I do want to express greatly is we had some good conversation with Mr. Donnelly and the rest of his constituents, and I'm very appreciative of that because sometimes we have not enjoyed that, and I give them kudos for that. Thank you so much. Some of our concerns were that it was that this is providing such a broad scope. As I talked with Mr. Donnelly, I think that may not be the case, but we still had that thought process of education and how a patient will come to a physical therapist or a DPT, in the distinguishing between a physical therapist and a DPT. And Mr. Donnelly can address that way better than I can. I think he's satisfied us well with that. The referral, the self-referral, Representative Kidd, I understand totally where you were coming from with that. And how does that get paid? What happens with that patient with the diagnosis? And where will that patient go if there's no resolution with the therapy that a DPT may prescribe for that patient? And again, Mr. Donnelly can speak to that way better. The diagnosis portion that we were concerned about, again, we thought that it was a little broader than apparently that it truly is, and I do appreciate that there are CPT codes or codes within the medical world that are specific to physical therapy, and I think that was very well satisfied. We've got more notes than notes should be allowed. The other thing that we looked at, line 281, with what happens with a physical therapy aid, and I think that was of major concern, and I believe that has been struck as far as the aid being able to perform any kind of procedure. So there again, I'm just trying to point out some of our concerns and some of the conversations that we've enjoyed and been able to work out with Mr. Donnelly and the rest of the gentlemen.
Sounds like they've done a good job answering them.
I think so too, but we still wanted to speak and let you know how things formulate between two providers, specifically, especially when it comes to Medicare and some of Representative Kidd's questioning in billing. And I think that's very prudent and very it was very timely. We appreciate that. I appreciate too Representative Cooper taking out the physical therapy and allowing that. Chiropractors do a lot of stretch and a lot of crossover therapies that we have learned from our physical therapy friends. So I think that's going to be I think that will be a major change for us too. But if I can answer any other questions chiropractically, I'd be glad to address those.
Got a question. Representative Rogers, thank you.
Yes, thank you, Mr. Chairman. Tell me your name again.
Karen Mathiak.
Okay, and where do you practice?
I practice in Griffin, Georgia.
Okay. How long have you been practicing?
30 years.
30 years. Okay.
Yes, sir.
Okay, for someone that's never been to a chiropractor, I did get a call last night from a chiropractor from Hall County. My concern is, why are y'all just now coming to the table on this issue? I mean, this bill's been out there. Chair Lady Cooper, how long has this bill been out there?
We've been working on it for
Bill's been a week, but the language has been out since January.
about a week that the bill's been
Week,
out, but
yeah.
people knowing that we're working on it for
Yeah.
about 3 weeks intensively.
Okay. Again, I'll address, why are we just now hearing from y'all?
Okay.
Why did I get a call last night at 6 o'clock concerning about this one term?
Okay. Our lobbyist, Aubrey Vlines, has been working
Aubrey, okay.
with Representative Cooper, and they have had good conversations. Apparently, Mr. Vlines has had great headway with and some, how do I say this, some good conversation that has produced changes that were very appropriate. So that's kind of why we were late to the gate, I guess.
Okay, well,
and I apologize.
I've never been
for
to
that.
a physical therapist. I hope I don't have to anytime soon. I've never been to a chiropractor, but I have been down here a few years, but that's neither here nor there. I was concerned because you're just now coming to the table.
Yes,
That's
sir.
the reason.
Yes, sir.
And that's usually not the way it's done.
Yes,
so.
sir. I agree with you.
Isn't
I
that right,
agree.
Aubrey? You've been here longer than I've been here. You look older than me anyway. Okay. Okay. Thank you.
I apologize for that, sir.
Thank you, Chairman Rogers. If you'd like to go to physical therapy, you can pick me up tomorrow morning about 7:15.
Mr. Chairman,
Yes, ma'am.
can I address
ma'am.
a couple of things? First, Representative Rogers, thank you for that, because usually, and that's one of my sore points about things coming so late. And it's like I said in the meeting before, not totally the only reason, but part of it has been the backup in Legislative Council and trying to even get a beginning draft of it to get it out there and then work through the changes and at the last minute. So I personally apologize for that. I mean, I'm not in Legislative Council, but I know that they're doing the best they can. But it is late, and that's one of my pet peeves, so thank you for asking about that. The other thing I will tell you that physical therapists are going to get self-referrals just like chiropractors get self-referrals. I go to both of them. I'm probably one of the few MDs or physicians' wives that will admit that both Tom and I went at various times in our life. And unfortunately, with having a total knee replacement, I spent a lot of time in the physical therapist. But as far as self-referral, if somebody sprains their ankle, they may decide on their own to go to a physical therapist. But this has a very hard, fast rule in it. It is a total of 8 visits on a self-referral up to, and they are 21 days. That 8 visits has to occur in 21 days. And that is a dead stop. That's it for that. If there's continued problems, they would be referred out to a physician or told that they would have to get a physician's referral before they could continue with any kind of physical therapy. I just wanted to make that. The bill is very specific that this does not go on forever, and there is a course of action to take if the person wants to continue or they don't feel like they're getting better.
Thank you, Madam Chairman. Ms. Karen, are you done?
Yes.
Okay.
Can I just make one more
Quick,
comment?
quick.
I think, too, that in today's we have a standard of care, and with this 8 visits in 21 days, that standard, the board, the physical therapy board, will hold their therapists to a standard of care, just like we do. And I think that is probably going to be a stop that won't be abused. So I appreciate that. I think that's going to be good.
Well, thank you very much.
Is there anything else, gentlemen? I saw somebody moving over there.
And I will tell you, Mr. Chairman, that I have found the Physical Therapy Board to be one of the most responsive boards and to police itself better than many of the other boards that we have.
There you go.
And I think lots of us know about the other self-policing of some of our boards, starting, unfortunately, with nursing on down, and I will say that for my profession.
Thank you, ma'am. Thank you, ma'am.
Thank you, sir.
Next up,
Thank you,
Robert
everybody.
Hayden. Is that right? Robert, if you'll jump up there and tell us who you're with, who you represent.
Madam Chair, Mr. Vice Chair, and members of the committee. Excuse me. I was just sitting behind you.
I know.
I was fine a few minutes
It's the
ago.
plague.
I hope you feel better.
Thank you. Just
Sound-
don't make me laugh again. It starts
No.
the coughing.
No more laughing at all, Madam Chair. My name is Robert Hayden. I've been in private practice in chiropractic for, this is my 20th year. I am much, much younger than Dr. Mathiak, so only 20 years, in Griffin. I am here with the Georgia Chiropractic Association. Historically, physical therapists have worked by referral from a medical doctor, from chiropractors, with the medical diagnosis in hand. There was some concern that this bill, as we were discussing it, represented an increased scope with less medical supervision. We have talked, and we are greatly appreciative of the dialogue we've had with Joe Donnelly, and have some of those concerns alleviated. The DPT is a new animal in the medical jungle. It's a relatively recent degree. The preparation in the Doctor of Physical Therapy program varies from program to program, but there is increased physical assessment preparation in those programs. We think that the bill could be strengthened, and I'm sorry, I don't have the new version, but line 261 of the prior bill. This says 5 years of clinical experience as an alternative for the DPT. Thank you. I believe, and I'm speaking here for the Georgia Chiropractic Association, we believe the bill would be strengthened by striking that provision and making the DPT the minimal level for direct access. It would strengthen the bill, I believe. I believe that would be in the interest of public safety, and I believe it would strengthen the PT profession in the state of Georgia. The physiotherapy term was not really a sticking point for us. Physiotherapy is a tool used by multiple professions, including physical therapy, chiropractic, even nursing. When I was in critical care nursing, I used physiotherapy modalities. Even massage therapists use it sometimes in our state. It is considered in the common domain like a blood pressure to a cardiologist. So that was not a big sticking point for the chiropractic group. We appreciate this dialogue as well. I look forward to looking to speaking more with Joe Donnelly and his working with his colleagues as this progresses, and in future issues as well.
Okay, Mr. Hayden, you have a couple of questions. First, Representative Bennett.
Thank you, Mr. Chairman. In reference to the 5-year practice, are you aware that, I may have to ask Mr. Donnelly, it has been, at what year was physical therapy entry level at a master's degree? It's been, how long have they been practicing at a master's degree?
In the late 1990s.
In the late 1990s. So any physical therapist that is perhaps practicing today other than a dinosaur may have their master's level preparation and now moving toward the DPT. So the 5-year may be there.
Yes, ma'am. The discussion from profession to profession about even minimal level of entry into practice is one that I've watched from multiple perspectives. I too am licensed as a registered nurse, and I remember all the conversations about the 1985 proposal to make the BSN minimal level of entry into practice. I believe that the DPT would greatly strengthen the skill set that goes with the DPT, would strengthen this bill for direct access.
Thank you. At the appropriate time, Mr. Chairman.
One more question,
Okay.
Madam Chairman.
Mr. Chairman, I would oppose any such amendment to make that change. And with no due respect to the presenter, when you question the caliber of the physical therapy schools, I think that would call into question the caliber of some of the chiropractic schools. I know the history of Palmer, but I am a resident of Cobb County, and I also know the history of Life Chiropractic College, when they started their days in their big student meetings with a chant saying money, 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 money. So before I would entertain one, I would have to have your guarantee that I could also write in that somehow or other we go back and say that chiropractors that are licensed in the state of Georgia that went to school at Life when it was under that kind of an administration would have some restriction on their ability to practice. So, as in with all professions, nursing too, I worry about the quality that we are turning out. But I guess that's one of the things when I think that somebody should clean up their own house before they throw stones at someone else's house.
Thank you, Madam Chair. Representative Beverly, you had a question.
This is just a friendly question. I'm not sure how a DPT has how many years of clinical experience before you get that designation. Is there a period of time that you have to have, or can you just go from school and once you get out 4 or 5 years or whatever?
So all physical therapist training now is at the Doctor of Physical Therapy degree, and that is 3 years post-baccalaureate.
Okay.
And then 1/3 of all programs are clinical educational experiences.
And just as a follow-up.
Yes, sir.
So the amount of clinical experience that a person has would be equivalent at the 5-year mark if you had a master's degree as a DPT.
That is correct.
Okay.
Thank you, sir.
Thank you.
Yes, Madam Chairman, go ahead.
There's no other, I don't know whether you have other people that would at least
We have no one else to speak, and at this moment I'd like to entertain, call for a motion.
Move to pass. Move to pass,
I'd like
Mr.
to
Chairman.
recognize Representative Bennett.
Thank you, Mr. Chairman. Move to pass.
Do you have a second? Second. Mr. Petrie. All those in favor? Aye. And opposed? Thank you, Madam Chairman. And those of y'all who worked so hard on this, we appreciate you.
Mr. Chairman and members of the committee, in case you don't know, Representative Bennett is a physical therapist.
Yep.